Hi, I'm Dr. Sheila Reyes from the Philippines, and I'm here in Chicago reporting live for Room Now for the ACR Convergence 2025. It's day two of the conference, and lots of information have been coming in since the start of the day. And for my video, I would like to talk about abstract number 1524, which was presented in the poster sessions earlier by the group of Dr. Karp and colleagues entitled Hydroxychloroquine Reduces Autoantibody Levels in Persons at Risk for SLE. So, just a brief background before I continue. So this mild trial was an RCT that set out to determine whether hydroxychloroquine could prevent the development of SLE in patients at risk. And results showed that hydroxychloroquine did not prevent the progression of SLE, and within that trial, some of the other outcomes were to collect biospecimens for mechanistic studies. And so this study, which is what I'm talking about now, Abstract 1524, assessed the effect of hydroxychloroquine on antibody levels to a panel of 120 potential autoantigens. And again, as I mentioned, biospecimens were previously collected from the SMILE trial. They underwent analysis, and where levels of the antibodies were compared from their baseline levels and those levels at the end of the trial or the last study visit. Okay, and also the patients were or the participants were grouped into either the progressors and those who developed SLE and the non-progressors. And of course, the antibody levels were compared. Now, results showed that the participants who received hydroxychloroquine had significantly lower autoantibody levels. That's about 93 out of the 120 autoantibodies that were studied at the end of the study compared to those who received placebo. And individuals who progressed or developed SLE had greater decreases in autoantibody levels than those or than non-progressors. Okay. Interestingly enough, the study also showed that the autoantibodies that were associated with progression or SLE were different from the autoantibodies that were affected by hydroxychloroquine. Now, there are some limitations, of course, in the study, and we have to really understand this based on context. Specifically, taking into consideration that the patients that were enrolled in the trial were mostly or those who had milder disease and probably where only hydroxychloroquine can be given. So results of the study can give some insights into the other possible mechanisms of how hydroxychloroquine affects disease activity or how it can better inform us for making better clinical trials. But until then, we'll have to wait for further data. I'm Sheila Reyes. Follow me on X at Rumarampa and tune in to Room Now for more updates of the ACR 2025.